Hello, this is Suzanne Connors Includoning Visions Hypnosis. I have a pretty intriguing question that came up when I was watching a video from one of the people who had posted a YouTube video stating why they left the world of doing mental health therapy. And that reason was because he felt that there was no science behind anything that he was taught to do, both in his training and in terms of practice. So I'm wondering if you believe that there's science to back up what is being done in mental health. Because when you think about it, and this is a point he raised, the Diagnostic Statistical Manual, DSM, has so many diagnoses in it that overlap one another. It's just a cluster of symptoms. And I know actually from the work that I did do in conventional mental health, when I was working in supported housing programs for the most part, it became pretty obvious that with some of the patients, the clients we had there, they had no clue how to diagnose them. I can tell you that there was one woman who was intriguing to work with. She was put down as a schizophrenic, but she was actually a person who had two totally different personalities. Those of us who worked with her every day saw them. And yet she wasn't being treated as a person with dissociative personality disorder. And then we have a lot of confabulation between bipolar 1 with psychotic events and schizophrenia. But they're two very different illnesses if you actually understand them for what they are. And what's the difference between a borderline personality disorder and a bipolar? Well, there again, there are some differentiations that need to be understood between the two. But often people are misdiagnosed and often people are not given the correct treatment for what they need because of the misdiagnosis. And that's a problem all the way around. Not to mention the fact that there's actually no science to back up anything that's in the DSM. Nothing. Check it out if you don't believe me. It's just a way to classify the patients, to hopefully give them the appropriate care, and to put the designation needed on the insurance forms for reimbursement for the work provided. Services rendered. That's what it's there for. So let's get really clear about what we're doing and why we're doing what we're doing. And maybe we need to look beyond all of that to really be able to help our patients and clients. And what I mean by that is to just listen to what's going on with them, to be present, to understand from their point of view what they're experiencing, and help them deal with the situations that arise in the best way we know how. I know that when I was working in the programs that I did before I got into hypnosis and neuro-linguistic programming, that's exactly what I did. I learned while I was working these programs pretty much every diagnosis in the DSM-3, because that was the one we were on when I was doing most of the work that I did in conventional mental health. And that DSM actually was pretty helpful in a lot of ways. I do believe the DSM-5 and 5R are pretty worthless because you can't diagnose every human emotion as a problem to be medicated. People are going to have things to deal with. People need to learn how to regulate their emotions. They need to learn how to interact with other people. And that cannot be done necessarily with a diagnosis and giving them a pill. These are things they need to learn how to do. And the way they learn how to do that is with really good role modeling and teach them different techniques in terms of how to be more present, to be willing to listen. Like I have a client presently that I work with, God bless her. She is a person who just gets really excitable. She was diagnosed with bipolar 2 in her case. And she is amazing at the over-talking and trying to do 15 things at once. And when I started working with her, I had to let her know, if you're going to be in session, otherwise you don't need to have the session. In other words, stop doing all this other stuff you're doing and be present. And if you can't do that, we need to reschedule to a time when you can. And with the over-talking, there were times when it got pretty hard to deal with because she just would not stop saying the same stories over and over again. And I'd have to be really assertive with her and just say, stop talking. Just stop. You're not listening. You're not learning. You're just going into the same story that you already told me 15 times, and it's not going to change, and it's going to not help to continue. So you have to have boundaries with our folks. And this woman actually does really love working with me. I can tell you that because there are a few occasions when I told her that if you're not willing to let me do the work, we don't need to work together. Let's just stop, Go find someone else to work with. And every single time she's like, no, I want to work with you. You help me a lot. So even when things get difficult, it's not that our clients and patients don't appreciate us. More often, they do appreciate us for giving them the boundaries that they need in order to bring themselves in to be able to truly concentrate on what they need to learn in order to get along in life. And certainly with this particular client, she's come a long, long way. When I first started working with her, she was destroyed by her boyfriend, who was really abusive to her, walking out. Now, because of the terrible abuse he did to her, she's in the process of getting him put in jail. That's a really, really, really big difference in terms of her learning how to take control of herself, her life, and to actually get justice done, which is the way that she puts it. And seriously, she does need to get justice done for her to be able to heal what happened to her in that relationship. It was a good call for her. Not easy, but she's doing what she has to do, and she's really doing quite well now. So I want you to really think about why you do what you do, how you go about doing what you do, what your patients are getting from the work that you do, even though you sometimes have to go through difficult times with them and let them know, if you can't do what needs to be done, maybe we can't work together. And that wakes them up. In neuro-linguistic programming, we call that a pattern interrupt because it interrupts their thinking pattern. It works really well, actually. But you have to have the guts to use it, which a lot of people don't have because they're people pleasers. I'm obviously not a people pleaser, never was and never will be, thank God. I hope a lot of people to not be people pleasers. And they're really glad to get beyond it. If you want to learn how to integrate hypnotism and neuro-linguistic programming into your healing protocols, I do offer a 2-day VIP program with a 12-month mentorship so that you can actually use it with your patients. And if you have questions between sessions, you can call. Well, you can message me and then we'll set up a video call so I can tell you exactly what you need to do, the order you need to do it. And I can tell you that my trainees absolutely love this program because you can do it on a Saturday and Sunday. Then you get the mentorship to help you for 12 months. And by that time, you've learned pretty much how to do what you need to do. And you're going to see real changes in your patients. We cannot help people with psychotic features, and we cannot help people with diagnosed personality disorders or people with an IQ under 70. But we can work really well with kids. I love working with kids. They're like really fun, and they're already in a hypnotic state, so it's easy. Anyway, that's all I have for you for today. As always, I thank you for spending your time with me. Till next time. Bye-bye, all.